UW360 is proudly supported by BECU, a not-for-profit member-owned credit union. Pacific Office Automation, copy, print, workflow, and IT. Problem solved.
My birthday was on June the 28th, and I went to work the next day, and when I got to work, I had driven to work, and I got out of the car and I had a pain in my leg.
Ralph Dockman didn't know that an aneurysm in his abdomen had ruptured. He began to bleed to death internally and collapsed in the parking lot. A colleague called 911, then called Ralph's partner, Andrea.
I was at work, sitting at my desk, and I got a phone call. Some person had found Ralph in the parking lot.
An ambulance sped Ralph to Harborview Medical Center and into the hands of vascular surgeon Dr. Nam Tran.
When he arrived here, he was quite sick. He was on the ventilator, had a tube in to help him breathe because he was unconscious. His blood pressure was low because he was actively bleeding.
I do remember them picking me up and putting me in the ambulance, and then everything kind of like faded out.
Ralph's aneurysm was in the abdominal section of his aortic artery. An aneurysm is a dilating of the blood vessel that occurs when an artery wall weakens, causing it to swell outward. When the pressure becomes too great, the aneurysm ruptures. The result can be catastrophic.
The way that I would look at rupture abdominal aortic aneurysm is that it is a major insult to an individual. It's similarly to be severely injured in a war, to get shot, and you are bleeding out.
Ralph survived in part because he was taken to Harborview Medical Center. New techniques pioneered here have significantly lowered the mortality rate for patients like Ralph.
3 years ago, we here at Harborview Medical Center implemented a protocol for managing patients with ruptured aneurysms using minimally invasive techniques, the endovascular procedures. And we were able to reduce the mortality in half, to cut it in half, for the first time in 30 years, in 3 decades.
Using this minimally invasive technique allows the vascular team to control bleeding before putting the patient under general anesthesia.
When patients present to us in hemorrhagic shock, they have bled into their abdomen, they're in pain, their muscles are tense, their blood vessels are clamped down, and those patients come into us in a very, very tenuous state, and their blood pressure is very low. When we bring those patients into the operating room, in the past we would prep the patient awake, and then we would look over the screen to the anesthesiologist and we would say, okay, go ahead and put him to sleep. And as soon as the patient was induced, he would lose that protective reflex, those protective mechanisms, and the abdominal wall musculature would relax and the patient's blood pressure would plummet down into the 20s and 30s and sometimes to nothing. And it was a mad rush to enter the abdomen and to get a clamp on the aorta and try and resuscitate that patient and get them back. Now, without any anesthesia or just some mild local anesthesia, we're able to bring those patients into the room, keep them awake, place a needle and a catheter into the artery in their groin, and go up with an aortic occlusion balloon and just simply inflate that balloon, much like placing a clamp on the aorta.
The vascular team successfully performed this technique on Ralph, followed by open surgery to close off the aneurysm and repair the aorta.
And the thing that actually gives me the most satisfaction for what I do, and the reason why I do this on a daily basis, is patients like him. He comes in, he's essentially dying, you're able to help him.
What is this place that
And
we're
when
going
Ralph
now?
woke up, his partner Andrea was there.
I still remember the way she was looking at me when I first started to come around to consciousness after surgery. And that look of relief and a smile on her face. She just looked like, oh, he's back.
Welcome back.
Yeah.
Throughout his experience in ICU and at Harborview, I recalled how much I love him. I fell in love with him all over again. And the fact that he was able to come back to me from where he was,
No, that's fine.
okay, is just amazing to me. I wouldn't be without him.